I think the most popular one in America is called Suck It Up. Deal with it. When I went to the doctor in America, which was twice in my life.
Twice ever?
Yeah, twice ever.
But I did have tons of experiences where like they just give you the medication.
And they're like, get out of my office.
Hi, welcome back to Pagoda One with...
Oh, John from America.
And...
Joanne from Canada.
And me, George from the UK. Today we're going to be talking about some kind of country comparisons, right? We're going to compare some stuff from each of our home countries.
Not country music comparisons. Got it.
No, I think my country doesn't have country music.
Which makes it much better. I still hate country music.
Country music is terrible.
Oh!
Hey.
Woo!
I agree.
Okay.
Oh, okay.
Hey.
Oh, woo!
Yay.
But that's not the country
what
we're talking about.
That's not what we're talking about. Today we're going to be discussing our healthcare systems. Ooh. So they vary quite a lot, and lots of my students are always interested to know about the US system, which I can tell them a little bit about, but the UK system is different, and it's interesting how they compare with the Korean system.
Yeah.
And the Canadian system, which is obviously the best.
But what I'm wondering the most about is let's serve up the best first.
I think realistically it's the best for
Then
last.
who's going first? Then
So
I'm
best
not sure who
for
goes
last.
first. I'm not sure who goes first.
All right, me
I
first.
think you go first, John.
So the reason I didn't want to go first is because America's, you know what? I'm going to start with the benefits of the American system. The
Okay.
benefits of the American healthcare system is that the technology, the ability, and the personalization of your healthcare can be one of the best in the world. You will get the best technology, you will get the best doctors, and you will get the best care. But the caveat or the kind of drawback is you have to pay for it. And it's a doozy. If you want to pay for the best, you have to be some of the more richer people in the world because it's expensive. All of the best ones are going to be private. The government healthcare is not going to be as good as the private healthcare. I'm going to be dancing so much around my words.
Do you know how
So
much an ambulance
can you
ride
give some
costs?
examples?
This is my second point of why I did not want to be first
Okay.
or even talk about this, is because if you're like, I live in this city, which means my healthcare is different than living in that city.
Well,
Right.
And I live in this state, which is different than that state. So it gets so complicated. An ambulance ride, there's probably an average of America, but it's definitely going to be at least $1,000 or more, unless you buy health insurance. I'm just talking about people without health insurance.
Right.
Even with health insurance, they're not going to be covering everything, but it's going to get too complicated. So I'm going to try to be as basic as possible. There are millions of systems. No, just joking. There are many systems in the US you can use. One is you can be on some government healthcare systems, but you have to have some sort of special privilege, like being old. I don't know if that's called a privilege, special circumstance.
Yeah.
Being old, being poor, or having something through your work, which I think is actually private, but at least it's through your work, so you don't have to pay as much. There's also co-ops where you can have like a bunch of people who come together and pay a little bit of money to have a private healthcare system. And then there's just you paying directly into the privatized healthcare system. That's the basic ones.
that was basic?
Yeah,
Yeah.
that's
That was deeply
very
complicated.
basic.
That was deeply complicated.
Yeah, and basically, I guess drop in the comments below like what your special circumstances is, because the thing is America is expensive. Even if you have government healthcare, it's expensive. I had no healthcare for a while, but even when I had the government, like a little bit of government healthcare, it was still like I had to pay 60% of the bill, and I'm like, I can't pay for 10%, so either you pay for all of it or I'm not going to the hospital. And I just
Right.
never went to the dentist, hospital, or anything. Which does make a culture of people who really take care of themselves at home. Like, I'm sick here and people are like, why didn't you go to the hospital? I'm like, why the frick would I go to the hospital? I can just stick at home, drink some tea, and be done with it.
Right.
Right.
Or take a bunch of pharmaceutical medicines.
A big pharma.
OTC, over-the-counter medications in America are quite strong because
Yes.
healthcare is not strong.
Yeah.
That's why when people say, I went to the hospital, my automatic reaction is, are you dead? Like,
Yeah,
did you
like,
die? What
yes.
happened? Did you
Yeah.
break a bone?
Yeah.
So you can go to the doctor for bad clothes.
I mean, some of
Your fashion
Some of
sense
the
is
fashion
terrible.
What's your sense of taste?
Yeah.
Niall.
COVID jokes.
That was a good one. That was a good one.
I'll start with the positives. So the National Health Service was founded in 1948.
Which is a
As
big positive.
Yeah, best thing. Old. It's old, guys. As a kind of reaction to after World War II, trying to kind of rebuild the country. The UK was destroyed in World War II, like London especially, like cities destroyed, lots of illnesses and poor people and blah blah blah. So the government, etc. So the government was trying to really rebuild the country and create this kind of social care, including healthcare and benefits and jobs and blah blah blah. Everything. So the healthcare system was founded to kind of give free healthcare to everyone. Is the basic idea, and it still continues today, more or less. If you're in the UK and you're a British person, you will receive free healthcare in a hospital or a doctor's surgery. However, some things you do have to pay for. Which
Did you say surgery?
Yes, sir. All surgeries would be free. Anything that's non-elective, so any necessary surgery.
Yeah. You can't change your face, but you can get like cancer.
Unless it's for medical reasons, right? If you have some plastic surgery, but not cosmetic surgery.
You have a question?
You said British people.
I did say British people. I don't know the ins and outs of the rules, but if you are not from the UK but you're in the UK, you can access healthcare. And kind of one of the principles of the NHS is free at the point of use. So generally speaking, it's free to get the healthcare, but they'll treat you, but then they'll maybe charge you later if you're not from the UK.
Right.
But like, generally speaking, for British people who live in the UK or people with the visa, residents.
Oh, so you can be a resident too?
Yeah, there's some specific rule I can't remember, but if you're a resident, like British citizenship, basically you get free healthcare essentially, except for dental care, optician visits, eye care. I think is in common in all of our countries. I think you have to pay for those things. It's going to be cheaper in the UK than it is in America, or even Korea maybe, I'm not sure. But still have to pay for it. One of the differences in the UK is that wherever you live, register at a local doctor's office. So not a hospital, like clinic. So GPs, general practitioners, like local doctor. So like in the town I grew up in, there was just one small doctor's surgery clinic. And you sign up at the clinic and you're just registered there. And you just get assigned one of the doctors who works there. And it's your local thing. Then if you have special needs, so some special care you need, if you need to see a specialist, that's what I'm trying to say. If you need to see a specialist, it's a really simple sentence. Your local doctor will refer you to the hospital.
Got it.
So generally speaking, family, we've received a lot of really good care for free. But one of the things you said about regionality, like local healthcare being different, varying across the country. In the UK, it does kind of vary. Because it's free, you kind of have to wait a long time to get seen. So you can't just walk into the hospital and say, I need to have this treatment right now and pay, because you just can't. So you have to sign up or wait on a waiting list for a long time. Or pay for private healthcare, which does exist. So it's pretty uncommon and it's expensive. But then you can get seen immediately and it's very high quality.
Let's hear about these long lines that you have.
Yeah, I mean, perhaps it's a Commonwealth trait, but yeah, we also have free healthcare over in Canada. Like you mentioned, because it's free, a lot of the people that end up going, they end up having to wait for a really long time. So maybe you might have an appointment at 9 o'clock, but you don't get seen until like 11. But if you miss your...
Just 2 hours.
Yeah, for us it's like
short,
2 hours.
It's a short wait.
Yeah.
It's very short.
And like you mentioned, I also like the fact that you mentioned about general practitioners. Actually, one of the things that happens, at least locally in my area of Toronto, is that because there are a lot of like general practitioners, sometimes they go doctor shopping. So like, oh, I don't like this GP, so I'm going to go to a different clinic and I'm going to sign up at a different clinic. Yes, I think that's one of the nice things about our medical care system, at least within Toronto.
You can shop around.
You can kind of shop around for like a GP that really works with you and you feel comfortable with, as opposed to like being forced and assigned to like a specific doctor that you don't really get along with. Other than that, I think a lot of the other medical like procedures, they're all covered generally. So like you said, surgeries, as long as it's a necessary surgery, then yes, it's all covered. CAT scans, MRIs, all of those things covered within medical coverage. And depending on what kind of company you work for, depending on what they negotiate as their medical insurance, sometimes you can get like optometry sessions, all of that stuff covered. Same for dental. So for me, one of the benefits, because my parents worked really comfortable jobs, is that they had really good medical insurance. And so growing up, everything is free.
Mm.
So yeah, I think it just depends on like the company that you're working for and how much they're willing to spend or expense for medical coverage and medical insurance.
Right.
Because you could work for a smaller company, but they might not invest as much into the medical insurance coverage.
That's interesting that, you know, well, obviously in America, but Korea and you guys too, all of you don't include dental.
Yeah.
Yeah.
I'm not sure because I think dental work is very important for overall
Oh
health.
yes.
Yeah.
Get on it,
Yeah.
NHS. And what is your called?
Well, it depends on your like province.
Oh, I
so we
see.
have like
So
13
gotcha.
provinces and
Okay.
territories.
Toronto healthcare
For
system.
ours, it's OHIP,
OHIP.
Ontario
OHIP.
Health. Oh wow, I'm forgetting the last two parts.
Insurance policy.
Insurance policy, probably.
No, definitely not.
Ours is called OHIP.
OHIP.
So, yeah.
OHIP.
I think the most popular one in America is called Suck It Up. Deal with it. That's
I was
another
like,
popular
That's a
I was like,
good
I've not heard of that. wait.
It's a good acronym. What? How do you spell that?
Just a joke, everybody.
Hey.
Kind of. Not a joke for me. It was a reality.
It was a
of course.
reality.
Mhm.
I have one question,
Yeah.
both of you.
Okay.
I kind of know the answer. Do you think the South Korean healthcare system is better than your country's healthcare system? In your experience.
Okay.
Yes.
So it's better.
No?
It's better because I can go to the doctor.
Oh,
Right.
But the
Yeah.
complaint that I have
Yeah.
is when I went to the doctor in America, which was twice in my life.
twice ever.
Yeah,
Twice?
twice ever. You could talk to the doctor and they would be so explanatory. They would be telling you everything that could happen. They would be there for you. They're like, a couple hours with you, 3 hours, 4 hours, it's fine. You're my customer, you're my patient.
Right.
Not every doctor is going to be like that, but that was my experience with the two. Whereas in Korea, it's kind of like, come in, okay, you're done, get out.
Yeah, it
Next.
feels like a
Right.
kind of money making.
Yeah, it's like
Factory.
in, out, in, out, in, out.
Yeah.
Has that been your experience? Like kind of in, out, in, out?
I think it depends on like the hospital too.
Okay.
Oh, okay.
I guess.
Yeah.
Yeah.
But I did have tons of experiences where like they just give you the medication.
And then like get out of my office.
Yeah.
Yeah, even in my experience when I was doing my medical check, I just remember, you go in, they're like, do you have any problems?
Push you around.
No, right, I feel fine. Okay, that's great. Okay, go to the next room.
Yeah, the health
and-
checkup is just you just like go to this room,
And you're-
done.
okay,
All these
sure,
checks.
yeah.
And I remember
Yeah.
my first experience in the hospital here. It was like my first month in Korea. Yeah.
Oh.
I arrived in Korea and I immediately I got tonsillitis. Immediately.
No.
Like we're talking within days. Days of arriving. It was terrible. And I had tonsillitis, so I was like almost dying. I couldn't go to the doctor because there was just no time. Finally went there, and I knew I had tonsillitis because I'd had it before. And I went into the throat clinic and
Mhm.
got seen by the doctor, seen really, really quickly. The doctor literally just opened my mouth, looked in with like the torch and said, yep, tonsillitis, here you go. And I was like,
Mm.
so I knew what it was.
Right.
I just got seen
That's
so
a
quickly.
benefit.
Yeah.
I feel like in the UK, I've had experiences where you have to wait maybe a week, or you have to like phone the clinic
Right.
in the morning, or go online in the morning to try and book an appointment, and it's like they all get filled up so quickly, and you have to wait weeks and weeks, especially if it's like not an emergency. They don't see you for a long time, and it's just difficult. Where here, you can get the thing you need so quickly.
How many
Yeah.
Americans are typing right now? This is why we can't have a NHS system. NHS? National Healthcare System. Yeah, NHS system in the US. We can't be waiting this long.
Right.
Guaranteed.
Yeah.
If you're that person, go ahead and post it. It's fun to read. And it's your opinion. I think we've killed this video.
Yeah,
Yeah.
I agree. Well, that was healthcare in the US, Canada, and the UK. Thank you for listening, everybody. Make sure to
Like,
comment
And subscribe.
and
share.
Take a breath. Take a breath. Bye.